Does COVID-19 only affect people from certain racial or ethnic groups? So there's no biological evidence that people of different racial or ethnic groups are inherently more susceptible to COVID-19. What we've learned about COVID-19 is that there are many things that determine somebody's risk. A lot of them have to do with just the degree of exposure that someone has, the ability they have to protect themselves, and the environment that they live or they work in. Because of many of these things are different in different socioeconomic groups. Socioeconomic groups are very tied to racial and ethnic groups in this country. And it seems like essential workers and people who live in places where there are many other individuals probably have the highest risk. Of course, there is overlap between racial and ethnic groups and these socioeconomic factors. But as I said, when you separate all of those things out, there are plenty of studies saying there is no difference in biological risk between those of different racial and ethnic groups. It much more has to do with the social and socioeconomic circumstances where people who are essential workers have to continue to go to work and don't have the ability to telecommute or work through the internet. They may or may not have adequate PPE to protect themselves, such as masks. They may work in more confined spaces without adequate ventilation. And they may be exposed to many, many people. Think about the person at a food counter who has to encounter a new customer every 15 minutes or so. So it's probably these factors and not an individual's race and ethnicity that determine susceptibility. Now, we've seen a lot of health disparities in terms of the number of infections and actually the deaths that have occurred. And this has to do probably with these socioeconomic factors that I mentioned before, as well as the prevalence of underlying conditions such as diabetes and obesity and hypertension in different racial and ethnic groups.